Hi everyone, it's Olivia here from Ostomy and Wound Care. Yes, this is our wonderful Envella Air Fluidized Sandbed. Just take note that this is a therapy bed. It's actually an aggressive treatment therapy bed. So it's not just your average Joe type of bed that you would see in the hospital. We don't want the tank type of bed arriving on our floor anymore. That was made back in the 50s and that's where it belongs. And we don't want that peachy Clinitron bed appearing either. We've had issues with entrapment and that type of thing with that particular style of bed. So this is the newest and the latest and greatest Envella bed. Okay, how do you order the Envella bed? Over here you'll see on your screen you can pick specialty bed. You're going to be clicking into this area here. You actually want to write something like Envella Sandbed from Hill Rom, and what actually happens with that particular order is it's sent down to Environmental Services, and Sandra Donaldson, who wonderfully takes that order, sends it off to Hill Rom, and you'll often find that that bed may appear in up to 8 hours on the floor, which is wonderful. You want to make sure you change that because we have had confusion where the Clinitron arrives. We will eventually get that changed on the system, but at the moment it is a glitch that we have to work with. I do hear about beds that get ordered and sometimes they will get denied, just to be aware of that. Sometimes they're simply not needed. They don't need that type of aggressive therapy. All right, let's go back and have a look at our sheet. This is actually a bed tip sheet from Hill Rom. On the Envella bed, you will find it actually in the charge's office, or you would actually contact your educator. She should have access to this particular sheet. I want to make you aware of a couple of fantastic features. So some of the features that we're looking at are actually adjusting the temperature, something important to remember. Probably sit between 88 and maybe 92 degrees Fahrenheit. And also these transferring features. You've got a feature if a patient is doing rehab on the side of the bed, you're able to adjust it so that you're able to help mobilize them out of the bed. The other is transferring from a trolley onto a bed. This is a great feature here because it will defluidize the actual sand bed. So they're great things. Have a look here. There's bed alarms. There's stuff for CPR as well. So they're good things to be aware of. When that bed first arrives on the floor, grab that rep, all right, because they have been trained to actually give you an in-service on the bed. I know a lot of them come up to the floor and then poof, they're off. All right, grab them back, wheel them in, and hopefully they can give you an in-service of about 5-10 minutes, give you an overview of the bed and how it works. Of course, you always switch that bed on. You can zero the weight before the patient actually gets on. You want to check it to make sure that things are working. You want to make sure that that sand is fluidizing through the bed and that function is actually working properly. Not that we've ever had problems with these new Envella beds, but it's something that you want to look at. Now, some of the other things to remember is one sheet on the bed is generally the rule, and you want a flat sheet. If the patient is incontinent of urine and stool, you would use a dry flow sheet. If the patient has a deep tissue injury on their actual sacrum or coccyx, you have to be really mindful that that patient's going to get therapy to that area from the bed. That's a real important priority. So you don't want to be putting Mepilexes over it. That's just another layer. Not only that, obviously you already know not to use a Mepilex if they're stooling or they're incontinent. So definitely something to remember. Often a question we get is, do we still turn a patient when they're in a sand bed? The answer to that question is yes, definitely. We have actually spoken on numerous times with Hill Rom about their bed, and they have said it is not the perfect bed. People can still get injuries, pressure injuries in a sand bed, believe it or not. So you are still doing the 2-hourly turns unless it's contraindicated with something else. And you're using a wedge. Remember, if they've got an injury in a particular area like the coccyx sacrum, you want to keep that wedge away from that area so that area can totally float. but it kind of position it in a way that you can still give that 30-degree angle to the sacrum. You've got a pillow behind the head, you've got a pillow between the knees, and really take time to look at the heels as well. You can roll a towel to the bottom heel, and I often use that top pillow between the legs to actually help float that upper heel as well. So that's just some of the things to remember when using the sand bed. You can always call me on extension 3339 if you've got any other questions. I'm just trying to think if I've missed anything. Bob?
Did we talk about Mepilex to a DTI on that non-incontinent patient?
Yes, okay. So if a patient does have a DTI, just a clarification here on their sacrum, you are not using a Mepilex. If they're incontinent of urine or stool, you are not using a Mepilex on that area. In fact, it's probably better not to use Mepilexes full stop in a sand bed, simply because you're getting that therapy that you would need. The only time that you would use one is if wound care is involved, and they're actually, treating or packing a wound, and they've placed a Mepilex over the top. Any other questions, Bobby?
I don't think so.
Okay.
Thank you so much, Olivia.